Well, a recent survey from MSU economics professor claims deaths due to COVID-19 immunizations could be as high as almost 280,000. Despite the CDC saying these vaccines are safe and effective.
McKoy Scribner caught up with the professor in charge of the survey. He's here for you now with what he's saying about the results. McKoy?
Sherry and Siobhan, the study claims almost 3,000 participants completed in the survey in 2021. And among them, more than 600 people say they knew at least one person who had experienced a severe health problem following a COVID vaccination. The professor used that data and projected it across the U.S. population, giving an estimate of what that number could be. But some say the study is flawed.
We had enough vaccine injuries among the respondents. They're able to look at and create an estimate of the number of people who may have died from the COVID vaccine.
Mark Skidmore authored the study, and he says with the findings, the estimated number was shocking.
The number was pretty large. It was about 278,000 people in the first year of the vaccine rollout.
Normally, health experts would conduct surveys and studies into these issues, not economists.
My background is as an economist and a policy evaluator, so my motivation was to help inform policy decisions at the federal, state, and local level.
Meanwhile, the Shiawassee County Health Director says
the CDC data shows that the vaccines for COVID are safe and effective.
And if people want concrete scientific data, the director says check with the CDC.
There is a reporting system called the Vaccine Adverse Event Reporting System, and it has received about a little over 18,000 reports of adverse events from the number of people that have been vaccinated across this country.
Skidmore says with these findings, he's only looking to bring attention and look into exploring the topic more.
This is not a final answer, but it needs more scientific exploration, inquiry, and discussion. And so that's my hope, is that we can look at this more carefully.
The study published last week in the journal BMC Infectious Diseases. It was updated 2 days later with an editor's note saying that conclusions of the paper are subject to criticisms that are being considered by editors and that, quote, a further editorial response will follow.